We talked about a little bit earlier that I could say the same thing about the NIH right now. And just the other day, it was announced that since the COVID-19 pandemic is over, we don't have to fund research on coronaviruses anymore. And a number of grants were slashed just a couple of days ago. And it's the same issue about understanding what it takes to actually move the process forward at the staff level.
Yeah, just to comment on, I think not a lot, maybe some, I don't know how to quantify it, but at least some of what we're seeing in terms of the policymaking and, this sort of, assault's the wrong word, but this kind of reaction to the public health agencies is a post-pandemic phenomenon where people feel that public health agencies didn't do certain things well, public health officials were overbearing, the guidance wasn't well formulated. All these different concerns and grievances about how we executed during the pandemic, many valid. There is a lot of learning to be done in terms of what public health writ large did during the pandemic and how we can do better. And some really, I think, in retrospect, some critical mistakes we made. Probably the most critical was not having a diagnostic test that we could deploy early on, not just to be able to know where the virus was, but to be able to know where it wasn't, so we could have targeted our mitigation. But there's been no effort to do any really serious, blue ribbon commission, after action look, come up with something that was nonpartisan, largely non-political, to really try to derive lessons learned and what a full scope of recommendations and reforms would be to make sure that we're better prepared the next time, that the mistakes we made are less likely to happen the next time, that public health itself is more likely to be judicious and mindful of some of the overhang from the pandemic and also some of the lessons learned. So in the absence of that, I think a lot of the kind of grievance coming out of COVID is being manifested in these, let's get rid of the public health functions, let's get rid of COVID research, let's get rid of mRNA vaccine research. And so it's very misdirected, and you're ultimately not going to achieve the kinds of durable changes in the infrastructure and the establishment that I think many people were hoping for.